BD2 adrenergic receptor is a G protein coupled receptor that uses the S class of G proteins. It is found in many tissues and has several effects when activated by epinephrine. Widens blood vessels, vasodilation. Opens airways in the lungs, bronchodilation. Think BD2 equals 2 lungs. Breaks down fat, lipolysis. Increases insulin release from the pancreas. Breaks down stored sugar, glycogenolysis. For energy. Relaxes the uterus, tocolysis. Helps prevent preterm labor. Increases aqueous humor production in the eye. Increases potassium entry into cells, cellular potassium uptake, which lowers blood potassium levels. USMLE style question 1. A 26-year-old pregnant woman is given a medication to prevent preterm labor. The drug is a B2 adrenergic receptor agonist. Which of the following is the most likely direct effect of this drug? A. Uterine contraction. B. Uterine relaxation. C. Decreased insulin secretion. D. Increased peripheral vasoconstriction. E. Decreased cellular potassium uptake. Correct answer. B. Uterine relaxation. Explanation. BD2 receptor activation causes smooth muscle relaxation, including in the uterus. This is why BD2 agonists like terbutaline are used to delay labor. A is incorrect. Uterine contraction is the opposite of what BD2 does. C is incorrect. BD2 activation increases insulin release. D is incorrect. BD2 causes vasodilation, not vasoconstriction. E is incorrect. BD2 activation increases potassium uptake into cells. USMLE style question 2. A patient is given albuterol for acute asthma. Which of the following best describes the main mechanism by which this drug improves breathing? A. Antagonism of muscarinic receptors. B. Blockade of BEAT1 receptors in the lung. C. Activation of ITE1 receptors in the bronchi. D. Activation of B2 receptors leading to bronchodilation. E. Inhibition of histamine release from mast cells. Correct answer. D. Activation of BD2 receptors leading to bronchodilation. Explanation. Albuterol is a B2 adrenergic receptor agonist. It relaxes bronchial smooth muscle, which opens the airways and relieves wheezing or shortness of breath. A is incorrect. Muscarinic antagonists, like ipratropium, also help in asthma, but are a different class. B is incorrect. BEAT1 receptors are mainly in the heart, not the lungs. C is incorrect. One activation would cause bronchoconstriction. E is incorrect. Histamine inhibition is the action of antihistamines, not B2 agonists.